trusts are trying to fix that problem by employing staff from abroad.
Is that the right solution? To discuss the issue, we can speak to Danny Mortimer, the Chief Executive of NHS Employers, the body which represents NHS trusts in England, and he joins us from Nottingham now. Morning to you. Thank you very much indeed for joining us. I mean, just look at these figures. What is it? 23,000 nursing vacancies in December last year. That is extraordinary numbers. Why are you letting that happen?
So a couple of things have happened in this last few years. The first is that as a result of the inquiry into the events at Stafford Hospital, the NHS had to increase the number of nurses it employed. The second is that we've seen a massively increased demand for our services, particularly for emergency care, and particularly as we've seen services diminish elsewhere in social care and in the community. Actually, more people are coming to hospital and more people are having to stay in hospital for longer.
Isn't that something you could have planned for?
In simple terms, we didn't, Louise. I think in particular the report into Stafford, I think nobody could have anticipated the extent of the changes we had to make there, and we've seen a dramatic increase in the number of nurses that we've required. And as you've seen, that means we've had to recruit in ever-increasing numbers overseas.
Okay, also, it's not just nurses, is it? 6,000 doctor posts also vacant as well.
Yeah.
So you're going to recruit overseas. Is that not costing you more money than training people here in the UK?
So we're doing both things. The number of training places have been increased in this country, both in medicine and in nursing, but it takes many years for us to feel the benefit of those extra colleagues. And in the meantime, and we anticipate for nurses, at least for the next 2 or 3 years, we do need to recruit overseas. And that's why for us it's really important that nursing remains on the shortage occupation list. That's the list that the government holds that allows skilled professionals to enter the country without all the hurdles that they've got to cross in terms of work permits. And as I said, for us, it's really important that nurses stay on that list.
I'm interested how much more it costs you to get a nurse from, I don't know, let's say the Philippines, for example, than one trained here in England.
It doesn't cost as much, actually. I mean, it costs us a significant amount to train nurses. But as I said, even if the cost was the same, actually it takes us several years to feel the benefit. I don't have the exact figures in terms of the degree costs or the agency costs to go and recruit in the Philippines.
Okay, so when you say you're trying to train more nurses, doctors as well, when are you going to see the difference?
So we've seen year-on-year increases in the number of doctors we employ, and we'll see that for the next few years as well. For nurses, we've got another 2 or 3 years, as I say, until we start to see a real significant increase in nursing numbers, and then we'll feel the benefit of that over the next few years after that.
And in the meantime, presumably this is costing the NHS more money in agency stuff, because that's an expensive way to fill it, isn't it?
Yes, it is, and that's been a significant and mounting cost pressure for us in the last couple of years. Both the level of vacancies and also the spend that we're having on agency staff is much more expensive than us actually going to places like the Philippines or elsewhere in the European Union and bringing nurses in from overseas.
Okay, thank you very much. We'll be speaking to the Royal College of Nurses later. Danny Mortimer, Chief Executive of NHS Employers. Thank you.
Thank you.
We should say